This is the Winning in Networking podcast. I'm your host, Dr. Michael Cortese, and my guest today is Chris Van Nostrand. And he has a strength and conditioning business where you teach people, mainly teens, about barbell weightlifting.
It's a combination. It's teens and then master's athletes as well. So I ended up on kind of both sides of the spectrum.
Cool. And then how did you get into that whole realm?
So I'd always had an interest in athletics and in sports and in training. And as I got older and discovered what really worked for me in terms of training, and as I discovered powerlifting, realized that coaching was probably the path for me.
Cool.
So after a corporate career, I decided to make the transition and really decided to, again, serve primarily master's athletes because that's what I was. And so I felt like that was a population that I could speak to in terms of balancing competition and training with family, a mortgage, a job, all that stuff. So that was really the first piece. And then ended up also kind of finding this population that I really loved, which was teens who are new to fitness and teaching them the confidence that you can gain through barbell lifting.
Yeah, awesome. So I know that the first time I met you, you were still in the position where you were kind of like 1 foot in your corporate job, 1 foot out. And I myself am in that position right now, but I'd love to hear more about kind of what it was like to be 1 foot in two different jobs. And you were, it's my understanding, like totally different even realms. So what was it like to kind of be in, working part-time for yourself and then working part-time for?
That's right. I was doing marketing on a full-time basis and had been in higher education administration my whole career, and then doing the coaching on the side. And I'm actually really glad that I pursued that path. I found out that's kind of how everyone does it for the most part, or a vast majority of people do it.
They've
got something on the side.
Yeah.
And so I'm glad I had the opportunity to do that, partly because it made it clear how much passion I had for coaching, because I kind of had the contrast of the thing where I didn't feel totally invested and I didn't feel like it was what I wanted to do with the rest of my life. And so when I would get off a coaching call or finish with a client and be totally energized, it really stood out in comparison to how I would have to spend some of the remaining hours of my day.
So how did you make that transition from going, working for the marketing firm and then?
Well, I wish I could say it was really well thought out. There was a plan. That for a while, there was a pretty good plan that I stuck with. But at a certain point, again, that contrast between the passion for the coaching and the lack of passion for the other thing, that just became kind of insurmountable.
Sure. What was the plan, if I can ask? What was your initial plan?
Yeah, that's a good question. The plan was to continue with the full-time marketing job until my wife completed her doctoral program so that she would be a practicing psychologist and be set up with her own private practice before I then made the transition, so that she would have a stable income before I did this crazy thing and quit my job. But we did the crazy thing anyway, and I quit my job. By that point, it wasn't that much of a leap because the coaching business was going pretty well.
Awesome.
I had a good stable of clients, so it wasn't a gigantic leap of faith, but it was still a little bit of a leap of faith.
You kind of have to, right?
At some
point,
I think that's exactly right. I learned that at some point, it's never going to be perfect where everything just seamlessly turns over. But I just felt like I was ready for it. And of course, there's a lot of people I've talked to have had this experience. As soon as I made the mental commitment to being a full-time coach, then business really exploded from there.
Yeah.
So I think it was kind of the mental switch on my part of being all in, and also, of course, just having more hours and being more out there.
Yeah, that's awesome.
Where do you think you are in this process?
What you were saying about that whole mental switch, I just know is going to be the same for me once I go all in on myself. Because like right now, my time isn't really 50-50. I'm obviously being able to spend a lot more time on my own business. So I'd probably say I'm like 65-35, not totally 50-50. But that 35% is just like, it might as well be 50 because the just having to like
Yeah, yeah, the switch
You use the
between.
word switch, which is really good. Like having to switch between the two is like draining in its own sense because you're like, okay, I'm doing this thing, and then okay, now I have to be doing this other thing. Okay, now I can focus on what I want to do, and okay, I got to do this thing.
It's amazing when you can apply all of that mental energy to just the one thing. It
Yeah,
really does feel like night and day.
yeah.
How much of it for you is about getting the space or finding a permanent space that you can work out of?
Well, actually, what I've been able to do recently is work out a deal with the gym that I'm currently at, where we've kind of sectioned off a section that's going to be just for me. So it's interesting because in the process of growing my own practice, I've been looking for, okay, where am I going to go that's going to have that private room that I need and then all the equipment that I can utilize. And the funny thing was that I was going around to different places. And as I was going around to different places, I realized I'm like, man, the spot I'm at is actually like perfect. I just need a spot to like say, okay, this is Dr. Michael's corner. You know what I mean? So I just talked to the owner and I was like, hey, I know that there's like this corner, that there's a couple of machines there that don't really get used that much. Can we move those machines and then just call it mine? So we're in the process of doing that right now. We've moved the machines. We're talking about putting in a hospital curtain that'll then give me some privacy if I were to need to do something with the patient that, you know, the rest of the gym wouldn't want to see. But in some ways, I've kind of found my spot, which is where I started. But just by moving some of the furniture, moving where I'm set up, it gives me more of that, like, okay, this is my spot feel now, which is really something I'm looking forward to growing into more.
I think that's one of the advantages of starting out now in the health field or in the fitness field is there's more space like that where you can have those kind of flexible arrangements. I teach my barbell classes out of Cornerstone Health down the street. They have a beautiful studio, and so that saved me from having to figure out how to take on a lease,
Sure,
which is
sure.
not something I'm too excited about. And that's what happens here too at TrueFit that Izzy runs. She has physical therapists as well
Mm-hmm.
in private rooms that also have access to this gym. So for anyone who's
Yeah,
out there who's thinking about this,
yeah,
the physical space I think doesn't have to be as much of a limitation as it might have been in
yeah.
the past.
It's actually been very interesting to start a practice, but not necessarily have my own clinic because I've actually spoken with other physical therapists who have started their own private practices. And when I tell them, hey, I'm in a personal training gym and I'm using the equipment, using the space, and I'm paying the guy to bring my patients there, a few of them that I've talked to was like, wow, that's awesome. I wish I would have known that I could do that as a physical therapist.
Mm-hmm.
And one of the things that I've seen, and I'm sure that you've experienced too, the process of entrepreneurship is really a lot like taking blinders off because I felt like in PT school, I was basically educated and trained to become a staff clinician, just an employee for
Mm-hmm.
someone. And going through this entrepreneurial route, I've realized that, like, oh, as a physical therapist, I have the training to help people solve a problem that they have. And that's marketable. It's
Mm-hmm.
not like I have to be within a healthcare system or something in order to provide those services. Like, if someone has pain with running, I can help you with that. So here's where I'm at, and I can help you. And the same goes for you with the barbell stuff.
That's absolutely right. Yeah, I mean, it's funny because I did get an MBA in my past life, and while helpful in some ways, it's totally different, or what you learn is totally different from what we're doing, which is bootstrapping.
Yeah, nice. Yes.
And so again, sort of helpful, but also, I had been in my career for 20 years, and so by the time I left marketing, I wasn't doing a lot of the tactical hands-on stuff. And when you're an entrepreneur, it's
Sure.
all tactical hands-on stuff. But I agree with you that ultimately it comes down to do you have a solution to somebody's problem,
Yeah.
whether it's pain with running or whether it's you're a power lifter and you've plateaued,
Mm-hmm.
or you're a young kid who doesn't feel super confident but doesn't want to and is excited about barbells but doesn't want to walk into a commercial gym.
Yeah.
So it's all solutions to
Yeah.
problems.
So okay, so here's a problem I have that I think you can help me solve. Okay. Because I have a patient right now that I've been working with for the past few months. And one of his goals is actually to get more into lifting. Okay. But he came to me because he has back pain. Okay. I've been working with him for a few months now, and I literally was just working with him today, and I just got him to the point where he can do a weighted hex bar deadlift, no pain. Okay, that's been months in the making.
Mm-hmm.
Okay, which is great because now I'm able to kind of run him through some traditional strength training stuff without any pain. But for me, I'm not really a strength coach. I'm not a personal trainer. And I know that one of his goals is to get more into the health and wellness uh, lifestyle. Okay. And free weightlifting isn't really something he's done a lot of. So even when I first evaluated this guy, when he was talking to me about his goals, I was thinking about you. And I was like, okay, this guy might be a good referral for Chris one day. So I just kind of wanted to know your thoughts about what would be a good way for us to hand off a patient that I have to you.
Absolutely. Well, I love working on those cases. And I would think of it less in terms of a handoff and more like how can we create kind of a wraparound care model for this individual. So I've worked with PTs in the past, and it's actually one of my favorite things to do is how do we integrate the PT and the strength coaching and the strength training so that it's a really nice, consistent, smooth experience for the actual client. And so thinking about, what is that bridge between PT and in particular lifting, how do we kind of build that connection?
Yeah.
And one of the things that I've valued most about jumping into the fitness industry is the level of collaboration, particularly here on the North Shore. I mean, just everyone's so open to just working together and even asking that question, right? The fact that you're asking that question is amazing. So I think of it less in terms of handoffs and more like, is this a situation where we might have a brainstorm session first and foremost.
Okay.
And if the client is open to it, then maybe think about some kind of dual model. But fundamentally, I love working with athletes, like I said, who are over 40, who maybe haven't really been exposed to lifting yet, because if they've been a runner for, say, 20 years, or they've been doing a sport at any kind of level, even if it's just a fun recreational league, or even if they're a elite competitor, if they haven't had strength training yet and then they add it in, the difference in their performance is so profound. And so I love seeing that transformation.
Yeah, lifting is often a missed piece for runners, especially because everybody's like, okay, run some more, but not enough people are really thinking about how the strength training piece can make you a better runner and make you more resilient from an injury standpoint. So one of the things that I'll do with patients all the time is I'll tell them, okay, pick up that dumbbell. We're going to do some calf raises, but you're going to hold the weight at least. You know what I mean? So the weights are just so beneficial for so many different people that it's instrumental. So kind of having access to equipment like this is super important for everybody. But let's keep talking about this potential not handoff, but collaborative patient, because this has been something that I've been thinking about for a while. In other PTs that you've shared patients with, is it typically because I know that there's a PT here, so would you see the patient in the same space as the PT on the same day? Is it something where, hey, you come and see Chris on Tuesday, you see the PT on Thursday? How has it worked for you in the past?
It's a great question. Right now, or the way that I've worked thus far, it's been independent sessions. But then, in particular, I've worked a lot with Dr. Heather Christian here at TrueFit. We will each do our independent sessions in our own locations with the client, and then we'll share notes back and forth with the client's consent, of course. And if they're working through an injury or they've got something that maybe is a little bit flared, I'll incorporate some PT movements from the PT into the actual training program that I write. So my coaching app, which has everyone's workouts, will include instructions and recommendations from the PT. And likewise, I will then potentially make regressions or progressions based on what's happening in the clinical side. So I think if nothing else, that gives the client a sense that they're being cared for,
of course,
and that there's just a level of commitment and a level of consistency too, because I think everyone has had the experience of that maybe disconnect when they're in any kind of scenario where maybe they're talking to a doctor who's saying, "Don't ever squat again,"
Yeah,
right?
right.
And they're seeing a personal trainer who's saying, "Let's deadlift,"
Yeah.
and then the PT might be somewhere in the middle, right, where
Sure.
they're like, "Let's build a rehab phase in here
Sure.
between those things," and I think that can be overwhelming for a lot of people unless you're extremely well versed in
Hmm.
exercise science or you just know a lot of the current literature.
Yeah. Yeah. The collaboration is very helpful. So the tell me more about this coaching app that you have. Is that like,
Sure.
are you giving people workouts like every day?
It
Like
depends on the
how
client. Yeah. So
okay.
my basic model and kind of my primary service is monthly online coaching.
Okay.
So it's a subscription-based program, and essentially the price is just determined by the number of live coaching sessions that you want. So you can do as little as basically 0 coaching sessions per week or per month, and you just get monthly programming that's customized to you every month. It's
Mm,
updated. You could see me multiple times per week,
mm,
in which case you're still getting your online workouts, but there's some
mm.
coaching taking live coaching
Huh.
taking place as well. And of course, there's an online coaching component of that as well. So I have clients that I only ever see in person, maybe once a month, maybe twice a month. We're talking about mindset, we're talking about performance strategies, and then otherwise they're executing their workouts on their own.
Mm,
So it's a little bit different than traditional personal training. But with that model, every one of my clients is in my coaching app. So they have their program that's assigned to them for each 4-week cycle. And then within that structure, they get a series of workouts that they do that are assigned to them. They could be daily. Most of my programs, I would say, average about 4 days a week, depending
mm,
on the sport or the individual. And then that also gives me the opportunity to be in really good collaboration or really good contact with the client because they can message me through that app. So it's a nice, consistent kind of messaging system. And we can also work on habit coaching as well.
mm.
So in some cases, if I'm working, say, with a power lifter who maybe just doesn't get enough movement in over the course of the day and it's impeding their recovery, then we can set, say, a daily goal for steps.
Oh, okay. And do you run into any problems with like adherence to the programs when a lot of it's virtual? That's something that happens a lot in physical therapy, where like we'll give patients exercises to do for home, and then sometimes the patient will come back and say, "Oh, I didn't do it." And it's like,
Not,
okay.
not usually, because the people who are looking for this service know that it's all about accountability.
Yeah,
So I provide the structure
yeah, yeah, yeah.
I provide the structure, but not the in-person accountability for the most
Sure,
part. So most people who sign up for it know what they're getting into, and
cool.
I will also, for local clients, I'll explain, this model here, this online model where we meet once a month. That's based on the assumption that you're going to be able to do your work, that you are
Yeah, yeah,
consistent and
yeah,
compliant.
yeah, yeah,
If that
yeah, yeah.
doesn't sound like you, we might be better off just doing regular in-person personal training sessions and not worrying
Mm,
about the coaching component.
okay.
And so I started as an online strength and conditioning coach. That was really the primary model. And then it was by virtue of having these conversations with people that said, well, I think I need more in-person
It's the entrepreneur.
experiences. I
I
think
saw the opportunity.
exactly. And so I realized that the in-person part was going to be an important part of the practice. Not necessarily the biggest part of the practice, but really valuable, particularly because as I got more interested in training beginners, the barbell stuff for beginners obviously works a lot better in person.
Yeah. So then you've mentioned the whole training people and beginners. You've mentioned the masters and the young kids. Would you say that that's your niche, or like what would be like an ideal client for you?
So the those kind of general populations are the ones I love working with. And then I also kind of drill down into the attitude side as well, because those are kind of demographic things like athletes over 40.
Mhm.
The folks that I find do really well with me as a coach are, I like to refer to them as growth minded individuals.
Mhm.
So these are people that really value the kind of coaching relationship that I like to develop.
Mhm.
It's very empathic. Um, there's a lot of communication, there's a lot of compassion involved in terms of, again, these being individuals that have caretaking duties and a lot going on. And so I think that the really rewarding coaching relationships I've had have been the ones where people were really interested in figuring out like what kind of mindset do I need to have to continue to do the sport I love into my 80s, and curious about what needs to change about my training for me to continue to run for the next 30 years. Or I'm a power lifter and I've been kind of doing traditional powerlifting and it's not working. Why is that? So the people who kind of have this growth minded or have this growth mindset and are kind of curious about different approaches to training, and again, really value the coaching relationship. Those are the folks I think, like from an attitudinal perspective, that I work really well with.
Awesome. So you mentioned the runners. I'm going to kind of hang on to that. So you've been someone that's been on my newsletter from like
I love your
the
newsletter.
beginning.
I love your newsletter.
I know. So I brought that up because you've been like one of my #1 fans. So I appreciate all the positive feedback you've given me on the newsletters. And then you've even mentioned on a handful of occasions, hey, I used something from your newsletter to help one of my clients who's a runner. So I just want to ask, like, from some of the content that you've consumed from me, what are some of the main things that have been helpful that I've put out into the world? Because I'm trying to see, like, okay, what are people understanding from the messages that I'm putting out? What's working when people are trying, and maybe what isn't working so well?
So I think the piece that's been really helpful has been really understanding the commonalities between strength coaching and barbell lifting and endurance training, particularly on the progression side. So I found that the way that you are thinking about progressing running and sort of slowly increasing load tolerance and load management and preparing soft tissues for the rigors of running is really similar to how I think about lifting. But with your endurance background, it gives me a clearer way to apply it to some of those clients.
Cool.
And I've also used your newsletter on occasion to reinforce a point that I've made from the perspective of a physical therapist, right? So if I have a runner who's feeling, a little bit of a twinge, a little bit of a tweak, and they're getting a little nervous, I will sometimes explain a concept, for instance, like, well, you increased volume and intensity at the same time. Like, you're fine. There's nothing structurally wrong. It's just you increased the distance that you were running and the pace of your running at exactly the same time. And so they might hear that, but then, a week after, I might have that conversation with them. If I send your newsletter about that to them, then it gets them to sort of reinforce the point.
Yeah, cool. Okay, so that intensity and volume one was a good one.
Yeah, and exactly, because I see it in the lifting world all the time.
Of
And,
course.
have guys come to me, usually guys, not to be stereotypical, who are pushing at an RPE 10, and they have been for months and months, and they're like, my shoulder hurts, and they're really worried about something structurally being wrong, and do I need to think about getting some imaging? What does this mean? I'm 40, but I want to be able to lift for the next 40 years. And typically, I'll do a 4 to 6 week GPP cycle where we add a lot of aerobic work, general physical preparedness. So we'll take a 4-week cycle where it's kind of just building their general base. So that includes their aerobic base. We dial way back on the intensity. Typically, it's a lot less volume, and they're really shocked and surprised that they might be doing 5 sets of bench per week while their shoulder kind of recovers. And then after 4 to 6 weeks, we kind of reassess, and normally that does the trick.
That's kind of nice.
It may be more than 4 to 6 weeks, but taking kind of this step back where, again, we rebuild some of the capacities or the capabilities that they may not have put into place, originally. Taking a step back can often do really good things for them, and it gets them out of also kind of this chronic pain mindset where you start to then live with that pain and then catastrophize that pain, and then it just becomes normal. And it's like, well, I guess I'm just a person whose shoulder hurts.
And then they identify with that.
They identify with
that's
the pain.
That's a hard.
And if you can get them out of that with a 4 to 8 week, general preparedness program, that in and of itself, I mean, even if I might not even touch technique. They're usually assuming that there's something wrong with their lifting technique. A lot of times I won't necessarily even touch technique. It's just on the load management side that we focus, and again, building that aerobic capacity. And usually that tends to do wonders for them.
Tell me more about this general preparedness phase, because I love that idea, because there are a handful of times I'll be working with someone who's running, and I really hate telling patients to stop running because they've heard that from a bunch of different providers. Like, oh, my knee hurts. When does it hurt? When I run. Okay, stop running.
Mm-hmm.
When I hear that, I'm just like, okay, I'm glad you're with me because we're gonna work with you.
You're gonna run.
You're gonna run to some capacity, right? But
Dr. Michael's gonna make you run.
I'm gonna help you with the running. Okay, we're not just gonna say, okay, that means you're done running.
Right.
Like,
or let's rest and let it heal for the
exactly.
next 6 months.
So that's kind of what I'm kind of wanting to tie in here, because there will be times that I'll be with someone and it's like, I want you to get back to running. The goal is to get you back to running, and in order for us to do that, we have to take a break right now. And maybe there's a decrease in volume and intensity that needs to happen for the fire to die down and for us to build the infrastructure to then have you increase that intensity back to what it was. And I've had success in doing that with a handful of patients. But I have like a couple people that I'm thinking of in my head that I haven't really been able to get them out of the cycle, even when there's a rest period. Tell me more about this general fitness preparedness, and I think I'm messing up your abbreviation.
Oh, general physical preparedness,
Physical
so GPP.
preparedness. Okay, yeah.
And I might not be using that term correctly. It's kind of, I picked it up at some point,
You can put
and it
your
kind of
name on
made
it.
sense
It's your name.
in the context of my coaching.
Yeah.
So, it really started again primarily from working with strength sport athletes and primarily powerlifters. And the big drive behind it initially was exactly like you were saying. People were coming in kind of beat up, and they wanted to, I think, hear, or they were worried that I would say you need to stop lifting.
Yeah.
And I don't think I've ever told anyone stop lifting weights for any period of time. I've said let's make adjustments, right? So we might do, if the bench is really bothering you, we might try a different grip. We might do partial reps. We might do pin bench. We might try dumbbells. We're going to do a whole bunch of things, and we'll find the thing that you can tolerate for right now. So there's no way in which you're, unless you've had a major injury or acute injury, or you've had surgery, we're going to be pressing in some capacity.
Awesome.
So that was one part of it, and the other was just that in the powerlifting world, aerobic fitness has not necessarily been a big component of that programming, but aerobic fitness is what actually drives recovery, and it drives work capacity within sessions as well. So I work a lot. That was really kind of the original impetus, was working with powerlifters and other lifters in general to increase their aerobic capacity.
That's so funny.
And they start to feel better when you do that. And so if you have then this combination of improved aerobic capacity, which is making recovery better between sessions, allowing you to push a little bit harder in sessions, and probably generally improving your quality of life. And you've found movements that you can easily tolerate that are maybe either the movement that you were doing at lower load or a slight variation, that starts to then rebuild confidence, and it starts to become kind of this nice cycle where you're doing good work, you can feel the effects. Because you're feeling the effects, some of that pain starts to go away. And I always tell clients, like, pain is an output from the brain as much as an input from the body.
Yeah.
So if you're giving yourself kind of positive experiences in the gym, those are going to directly impact the amount of pain that you're sensing, because not everything is biomechanical.
Dude, I love that. That's like super holistic. That's a very holistic way of looking at it too, right?
I think so. Yeah. I mean, it's. I think that that's another one of those aspects where coming to my coaching career a little bit later was helpful, because I'd had a bunch of life experiences. I'd had a bunch of injuries. I had dealt with the stress of trying to work out with 2 kids. And so trying to figure out all that stuff, I think hopefully has been helpful in terms of being able to provide a holistic experience. So tell me a little bit, I guess I'm curious now, like, so how do you deal with some of these clients that maybe have a hard time breaking through that idea that they should keep moving?
Well, I'm going to take the exact opposite side of the same coin that you were just saying. So, and I was going to tie into this in a second, was this idea that, okay, you're working with the people who are already lifting, and you're kind of dialing back the lifting intensity, and please correct me if I'm wrong, but this was my understanding of it, that if there's some injury that needs to be, addressed, you'll dial back some of the lifting intensity, and then you'll ramp up some aerobic capacity.
Correct.
Right? So for physical therapy for running, it's almost the reverse, where I'll start to have them reduce the running volume, and then I'll introduce, because a lot of runners aren't lifting, I'll introduce lifts that strengthen the muscles, the ligaments, the joints that contribute to a pain-free run. Now, so I'll take that approach as well. One thing that I do a lot that not a lot of other physical therapists are doing is actually addressing the way that the patient is running. So having pain with running is one thing, but I just got off the phone with a patient who I'll be seeing next week. And she was saying, I've been in therapy for many years, and my hip only hurts when I run. And I'm like, okay, has anyone worked on your running stride? No.
Right.
Been to a bunch of other PTs,
and that's the actual source.
And that's where people start to get frustrated when they hear medical providers say, "Oh, it only hurts when you run." Well, stop running. And it's like, no, because I want to live a healthy life.
Right.
I want to run. I have these races coming up. Like, it's good for me to run. It's good for my family to run. It's good for the culture of the area that I'm in if I'm healthy and happy. And if I'm having pain with running, that's stopping me from being my best self. So one of the main things that I do with my patients is I look at how they're running, okay? And then if there's something wrong with that, I'll correct it. And you'll be amazed the number of times that something that for me is like low-hanging fruit has just never been addressed for the patient, and it's often the thing that flips it for them. And they go from being in a position where they can't run and it hurts to run to being like, oh my God, I'm running and it doesn't hurt. And my knee has been hurting for years. And now it doesn't hurt, and I'm running. So it's been really rewarding to do that for many different people, and it's really come down to addressing the way that the patient is running. So that's why the running gait analysis component of my care has been so monumental.
It does seem like an incredible service. As someone who recently got back into running after a long layoff, because I fell into the trap that we've been talking about myself, right, which is I sort of identified with this ankle injury and I sort of let it define me as someone who doesn't run, as opposed to someone who just had a little bit of joint pain. As someone who just got back into it, that totally resonates. That however I was running in the past, I don't think is the way you're supposed to run. I
hope you've read my newsletters and have thought about.
I have thought a lot about midfoot strike. Yeah.
Yes, dude. Yes.
And I see that. I mean, I said that sometimes I don't even look at technique at first.
Yeah.
But that sometimes initially I won't look at technique because I don't want to overwhelm somebody.
Yes.
Like
that can be a problem.
We're gonna tear down your technique,
that can be a problem.
And we're going to change your programming, and we're going to have you do cardio.
Yes.
So sometimes I leave the technical stuff until they're a little bit more bought in, or they feel like they've made some progress. But I totally agree with you, and I see this in all the main lifts, that often a really simple change, like the positioning of the shoulder blade, or the space between the shins and the barbell on a deadlift, that one change can totally alter their experience.
Yeah, it's a fascinating principle of physics, right? Like it's all just like joints and levers. So the farther something is away from you, the more difficult it is to control. So I'm going to make a comparison here between, you were mentioning, deadlift bar should be as close to your shins as possible. So the further out you put it, the more torque it's going to put on your low back.
Exactly.
And then something very similar is true in running, where if your foot lands super far out in front of you, it's just like quite simply a longer lever, and it's a lot more difficult for your body to control the limb when it's further out in front of you. So that's where you get a lot of the pain coming from, this idea of overstriding.
And is it true too that you then can't absorb that force as efficiently if that foot is further out?
Yes, that's one piece of it. Really, the shock absorption component of that has more to do with the knee bend. Okay, so you want the knee to be bent when you hit the ground running. And that really just helps attenuate the shock. And when people heel strike, They have essentially, it's not a totally straight knee, but their knee is relatively straight. Their toes are lifted, and when their foot hits the ground, the shock just goes right up the leg. So, like I was mentioning, this lady, like I can see it from a mile away. I haven't even seen her yet. I was on the phone with her earlier today. She has pain with running. She hasn't had her running gait corrected. I already have an idea. I'm like, I have something. I'm like, okay, here's the first thing I'm going to go for. Okay. And there have been times where I'll be working with a patient and their knee hurts, and it's literally like, it can be like the flip of a switch. It's crazy where they're running and they're doing this and their knees are sore. And then I help them midfoot strike. And it's like, oh my God. I've had a lady on the treadmill be like, I cannot believe I'm running without pain right now. And then she later competed in her triathlon and won her age group.
That's incredible.
Without pain.
That's incredible.
And it's like in some PTs, like people aren't even like talking about this. They're not even talking about the whole midfoot thing.
If someone comes to your cross training class for runners, I feel like there must be a lot of plyometrics there.
Yes. So there is a lot that is related to like all the exercises are tailored for runners, you know, but the funny thing is about that is I had to nix that program. I'm not doing it anymore. It was a little bit too difficult for me to juggle that with, like, it was like a bandwidth problem. I'm not really like a group fitness instructor, and it was just kind of like, okay, well, I can do this thing, but I don't know if it's really.
Classes are challenging.
Yeah,
those have taken a lot of time and a lot of nurturing for me to get off the ground. I'd say actually launching the barbell classes has been the hardest thing that I've done.
Yeah.
As a coach.
For teens.
For both. So I have a teen barbell program and then also one for adults. It takes a lot of work. I'm really proud of that class, but I think if you're thinking about managing your time here as you're one foot in both worlds, it makes sense to I was spread way too thin.
I was spread way too thin, and I kind of realized that shortly after starting it. I was like, I don't know if I can sustain this. And it's interesting because I see a lot of parallels between running and in the endurance sports and like entrepreneurship, and like there is a component of like endurance that you need, right?
That's true.
For like going about it. So
and of course, your own training is the easiest thing to give up when you're running a business. But you have to prioritize it.
Yeah. So I'm looking at a couple races to sign up for next year. I don't think I'll do another Ironman next year, but
Now, so on that note, you've talked a lot about runners, but you're working with triathletes as well, right? Swimmers and cyclists.
Yeah. So I actually a large component of my caseload is triathletes. Now, the interesting thing is that I will work with them mainly on the running piece. I have worked with patients that have shoulder pain with swimming. I have worked with patients that have back pain with cycling or knee pain with cycling per se. But really, my bread and butter is runners.
Do you think that's because running is just more inherently physically demanding, or is it that it's easier to have incorrect technique with running that can lead to issues?
Yes.
Both.
Both are correct. I think there's also a third component in there, in the fact that as a triathlete myself, I actually like running the best of all the three sports. I wouldn't consider myself like an elite athlete in any of them, but the one that I, Dr. Michael, like the most is running. So in my marketing, in my practice, the general draw is that I attract runners. And that's fine with me because I like talking about running and I like, treating runners.
That's the thing I notice most in your marketing that I think is so impressive. And this does come out of my marketing background, is your ability to be really focused on your niche.
Yeah.
It is crystal clear what you do, for whom, and in what formats.
Yes. Yeah.
And
thank you.
It's much easier for people to know if you're the person for them if they're clear what you're about. Right. And so you've just been incredibly, I think, consistent on that.
Thank you.
Which is super impressive.
Can I tell you who I have to thank for that?
Who?
My BNI networking group. Have I talked to you about my BNI?
You have, and I was a guest there.
That's right, dude. I owe a lot of my marketing clarity to the BNI networking group, because every single week we get the opportunity to speak 45 seconds about our business to the entire group. So every time I do that, I just sharpen the message, sharpen the message, sharpen the message. Every single week we meet and I sharpen that message, sharpen that message, sharpen that message. Another component of the BNI networking group is having one-to-ones. So I'm very familiar with sitting down with someone and talking about my business because I've done it almost 100 times now at this point. Okay, I actually have the record for the most one-to-ones in a 12-month span.
Congratulations.
Thank you. I'm holding on to that, and I'm very much.
Did you get a plaque?
No. But my name's up there every week. Every week, and who has the most one-to-ones in the last 12 months? Michael. I'm at 74 right now. But in any case, like just being in that networking group has really just helped me refine that message and just stay focused. Because if I were to go out and say, I'm a physical therapist, I can work with anyone, it doesn't really like help anybody, one, refer business to me.
Am I anyone?
Exactly. Am I, you know what I mean? So it's like, but if it's like, I'm the running physical therapist, okay, boom. It's like really clear. So like when you think of someone that has pain with running, if you're running into problems, pun intended, if you're running into problems with them and they're like, man, it still hurts when I run, I would hope that you'd be like, okay, well, maybe you need to get your running gait analyzed.
Absolutely.
Head on over to Dr. Michael, that kind of thing. Or, I have a race coming up and it hurts when I run and I'm worried that I'm not going to be able to show up to the race. I'm the running physical therapist. That's like what I do. I was so busy this summer with all these people training for their fall races. So now it's kind of a little bit slower now that the Chicago Marathon's over, but I'm getting into the off season and I'm helping people start to really dial in their running form who we didn't change their running form because they had a race coming up. So sometimes if a patient's doing well, even though I know that their running form can be better, if they're running without pain and they have a race coming up, I'm like, okay.
Absolutely.
If it ain't broke, don't fix it.
I'm not touching somebody's squat 4 weeks before meet.
If it ain't broke, don't fix it, okay? Finish your race. Once you're done with the race, we still have some sessions left. Let's go ahead and let's tweak your running form and let's make it so that this off season is an off season of preparing you for the next season to crush your PRs because you'll be running more efficiently, you'll be less prone to injury, and it'll essentially just make you a better athlete.
I'm glad you mentioned the off season because I think that's one of the most valuable areas for a coach to address, particularly for masters athletes who, again, may be more in the recreational space or identify more as recreational athletes. They haven't necessarily thought about a structure to their year. So one of the first things I do as part of my assessment and then my initial plan is we lay out over the next 12 months, regardless of their level of competition, let's think about over the next 12 months how things are going to work. So you know that you're going on vacation in June. So let's build that in, right? That's not going to be a high intensity training period. You said you wanted to do these, a meet here and a 5K here, powerlifting meet here and a 5K here. Let's think about what that's going to look like over the course of the year. So we know you're going to peak here and taper here, and then you're going to have this nice period where you're enjoying your workouts, but maybe we'll call them freestyle workouts. You get to spend a month kind of doing whatever you want.
Sure.
And so, again, for people who have caretaking duties, they're working professionals, they've got a bunch of other things on their plate, just seeing that I don't have to push it all the time, or there is kind of a rhyme and a reason behind how I'm going to approach each part of the year, that can relieve a lot of stress from somebody's plate.
Yeah, that's awesome. Well, it's really cool how you really take a really professional approach to treating all your clients. So, Chris, it was really nice to talk with you.
Likewise.
Dude.
Yeah, this was awesome.